In our first volume of Cancer Therapy Evidence Update, we report new research evidence on 7 different types of cancer therapies. These include Cadonilimab, Anlotinib, Aumolertinib, Pembrolizumab, Clostridium novyi-NT, an attenuated bacterium, Givastomig, a bispecific antibody, and Ipatasertib. Some of these studies explore combination therapies, while others investigate single therapies. All these studies were published in 2025. This presentation covers 5 studies, 2 done on lung cancer, and 3 on multiple solid tumors. Lung cancer. Lung cancer. Study 1. Title: High-dose Aumolertinib for untreated EGFR variant non-small cell lung cancer with brain metastases. The ACHIEVE Phase 2 non-randomized clinical trial. This is a single-arm, non-randomized Phase 2 trial. The Phase 2 trial tested high-dose Aumolertinib in patients with untreated EGFR mutant lung cancer and brain metastases. Results showed promising survival benefits and manageable safety. The key findings of the study were summarized under 5 main categories: progression-free survival, overall survival, objective response rate, adverse events, and biomarker findings. The study enrolled 63 patients, with 61.9% female and a median age of 60 years. This demographic breakdown provides a moderate sample size that allows for subgroup analysis, especially between those with and without CNS evaluable disease. 49 patients, 77.8%, had measurable brain lesions and were included in the CNS evaluable foresponse set, making it a significant subset for intracranial efficacy analysis. Progression-free survival, or PFS, refers to the time a patient lives without the disease getting worse. In this study, the 12-month PFS rate was 62.1%, and the median PFS was 20.5 months. The intracranial PFS at 12 months was 76.8%, and the median wasn't reached during the study period. Overall survival, or OS, measures the time from treatment until death from any cause. Here, the median OS was also not reached, which suggests prolonged survival among the patients. Next, we have objective response rate, which is the percentage of patients whose tumors either shrank or disappeared. The systemic objective response rate was as high as 88.9% in the full analysis set, and the intracranial response was 82.5%. These were similarly high in the subgroup with measurable brain lesions. Moving to adverse events, the most common severe side effect was elevated creatine phosphokinase levels, seen in 27% of patients. Fortunately, no treatment-related deaths occurred. Finally, under biomarker findings, patients who showed clearance of the EGFR variant in their blood by day 1 of cycle 2 had significantly better outcomes, with a hazard ratio of 0.14, indicating a strong association with longer PFS. You'll notice some of these results include a 95% confidence interval. This simply means we are 95% confident the true value lies within that given range. It helps show the reliability and precision of the findings. Overall, the data suggests that high-dose Aumolertinib has a promising treatment effect in patients with untreated EGFR mutant lung cancer and brain metastases. The drug has manageable safety and a high potential for biomarker-based prediction of outcomes, evidenced by high response rates, significant PFS benefits, predictive value of EGFR clearance, and acceptable safety profile. The drug also has a manageable adverse event burden. Lung cancer. Study 2. Title: Efficacy and safety of Cadonilimab plus Anlotinib in small cell lung cancer with brain metastases. This retrospective study assessed the efficacy and safety of Cadonilimab plus Anlotinib in small cell lung cancer patients with brain metastases. The findings suggest this combination may offer a promising and well-tolerated treatment option for this hard-to-treat population. The results are summarized under 4 categories, namely, intracranial objective response rate, median overall survival, predictors of poor OS, multivariate Cox, treatment-related adverse events TRAs, and severe TRAs grade 3 to 4. The study results are presented across 3 key domains: efficacy outcomes, which assess the treatment's ability to control disease; prognostic factors, which identify patient or disease characteristics influencing survival; and safety and tolerability, which evaluate the frequency and severity of treatment-related side effects. 46 patients with small cell lung cancer and brain metastases were included, providing a moderate sample size to assess treatment efficacy and safety in a real-world setting. Intracranial objective response rate is the proportion of patients with a measurable reduction in brain tumor size, complete or partial response, based on response assessment in neuro-oncology brain metastases, RANO-BM, criteria. 41.3% ORR indicates that roughly 4 in 10 patients experience significant shrinkage in brain metastases. This suggests a moderate intracranial efficacy of the treatment regimen. Overall survival is the median time from treatment start until death from any cause. From the results, the best estimate of the median survival is 19.3 months, and we are 95% confident that the true median survival for the population lies between 17.4 and 21.1 months. Statistically, this means 50% of patients lived longer than 19.3 months. The narrow CI reflects a reliable survival estimate for this population. Multivariate Cox regression analysis identifies independent factors associated with survival while adjusting for other variables. PD-1 expression level is a biomarker that may predict immunotherapy response. Less than 50% suggests low expression. HR equals 4.83. P less than 0.001, patients with PD-1 less than 50% had a 4.83 times higher risk of death compared to those with higher PD-1. The result is statistically significant, indicating strong prognostic impact. It is statistically significant because the p-value is less than 0.001, meaning there is less than a 0.1% probability that the observed difference in risk HR equals 4.83 happened by chance alone. This strongly suggests a true association between PD-1 expression and survival outcome. Low PD-1 expression is a strong negative prognostic factor. Greater than or equal to 2 metastatic organs means having 2 or more organs beyond the brain affected by metastases. HR equals 2.71. P equals 0.036. These patients had 2.71 times the risk of death compared to those with fewer metastases. The finding is statistically significant and clinically relevant. This result is statistically significant because the p-value, 0.036, is less than the conventional threshold of 0.05, indicating there's only a 3.6% chance that the observed 2.71-fold increase in risk occurred by random variation, thus supporting a likely true association. The results indicate that extensive metastasis is an independent predictor of worse survival. Treatment-related adverse events are side effects or complications directly linked to the treatment received, regardless of severity. 86.9% of patients experienced at least one TRAE, indicating that adverse effects were common, though not necessarily severe. This reflects expected toxicity in such combination therapies. Severe treatment-related adverse events are serious side effects classified as Grade 3 severe or Grade 4 life-threatening based on standardized toxicity grading. 17.4% experienced severe TRAs. While less frequent, this highlights the need for monitoring and possibly managing high-grade toxicity during treatment. While the treatment had measurable benefits, it also carried a high risk of toxicity, which must be considered in clinical decision-making. This study suggests that combining targeted therapy and immunotherapy can achieve meaningful intracranial control and extend survival in SCLC patients with brain metastases. However, patients with low PD-1 expression or multiple metastatic sites may have poorer outcomes and should be closely monitored or considered for more aggressive or alternative treatment strategies. The high rate of treatment-related adverse events also highlights the need for proactive toxicity management during therapy. Multiple solid tumors. Multiple tumors. Study 1. Title: Phase 1b study of Pembrolizumab in combination with intratumoral injection of Clostridium novyi-NT in patients with advanced solid tumors. The study evaluated Pembrolizumab combined with intratumoral Clostridium novyi-NT in patients with advanced solid tumors. It found the combination was well tolerated and showed promising anti-tumor activity in treatment-refractory cases, highlighting its potential as an innovative immunotherapy strategy. The results were summarized under 4 categories, namely, safety profile, dose-limiting toxicity, treatment-related adverse events, maximum tolerated dose, objective response rate, tumor types with responses, response types, duration of response, and disease stability. Between July 2018 and September 2022, 16 patients with advanced refractory solid tumors were enrolled. The median age was 62.5 years, with breast cancer and melanoma being the most common tumor types. Most patients were female, and all had an Eastern Cooperative 203 oncology group, ECOG, performance status of 1. By the data cutoff, all patients were off study, with 75% experiencing disease progression. Safety profile is a summary of side effects or risks observed during treatment. The safety profile of the combination therapy was described as manageable. This means that although side effects occurred, they were not severe enough to stop treatment or cause major harm. Patients were able to continue treatment without experiencing overwhelming discomfort or health risks. Dose-limiting toxicity is a side effect serious enough to prevent increasing the drug dose further. In this study, one patient experienced abscess formation, a collection of pus due to infection, which was categorized as Grade 3 in severity. This side effect was significant enough to help determine the safe upper limit of the drug dose. Treatment-related adverse events are side effects believed to be caused by the treatment. Several side effects occurred in at least 10% of patients, and were mostly mild to moderate, Grade 1 or 2. The most common was injection site reaction, 25%, followed by fever, pyrexia, at 19%, and 3 others, itchiness, pruritus, low white blood cell count, leukopenia, and low red blood cell count, anemia, each affecting 13% of patients. These were expected effects of the treatment and were generally tolerable. Maximum tolerated dose is the highest dose of a drug that does not cause unacceptable side effects. The maximum tolerated dose, MTD, is the highest drug dose patients can receive without severe side effects. In this study, the MTD was established as Pembrolizumab 200 mg given through the vein every 3 weeks, combined with a single intratumoral directly into the tumor, injection of 100 times 10 power 4 Clostridium novyi-NT bacterial spores on day 8. This combination was found to be safe for most patients. Objective response rate refers to the percentage of patients whose tumors shrink or disappear after treatment. The objective response rate measures how many patients had significant tumor shrinkage or disappearance. In this study, 25% of patients, 4 out of 16, had such a response, meaning the therapy was effective in reducing tumor size in a quarter of those treated. Tumor type means a specific kind of cancer where treatment showed a positive response. The 4 patients who responded to the treatment had various tumor types. These included cancers of the nasopharynx, upper throat behind the nose, base of the tongue, vulva, a rare melanoma, and a bone-related tumor called chordoma. This suggests the treatment had potential activity across diverse and difficult-to-treat tumors. Complete response is where all signs of cancer have disappeared following treatment. Partial response is where tumor has shrunk, but is not completely gone. Of the 4 patients who responded, 3 experienced a partial response, where the tumor significantly shrank, but did not completely disappear. 1 patient had a complete response, where all signs of cancer vanished. These outcomes are positive indicators of the therapy's effectiveness in select cases. Duration of response is how long the tumor remained reduced or disappeared. Median duration of response is the middle value for how long the tumor remained reduced or disappeared. The median duration of response among patients who responded to treatment was 10.93 months. This means that half of the patients maintained their tumor reduction for nearly 11 months or longer, indicating sustained benefit over time. In this study, a condition of stable disease is when cancer did not grow or shrink significantly, it remained controlled. In addition to those who responded, 69% of patients achieved stable disease. This means their cancer neither grew nor shrank significantly, but was kept under control. While not as dramatic as tumor shrinkage, disease stability is still considered a favorable outcome, especially in advanced cancer. The study discovered that a combination of intratumoral Clostridium novyi-NT spores and intravenous Pembrolizumab in patients with advanced solid tumors was generally well tolerated, with a clear dosing protocol and minimal toxicity. It achieved an 81% disease control rate, including durable responses lasting a median of 11 months. The therapy showed promise across a range of tumor types, including rare and aggressive cancers. Multiple tumors. Study 2. Title: A first-in-human study of Givastomig, a CLDN 18.2 and 4-1BB bispecific antibody, as monotherapy in patients with CLDN 18.2 positive advanced or metastatic solid tumors. This study evaluated Givastomig, a bispecific antibody targeting CLDN 18.2 and 4-1BB, in adults with advanced or metastatic solid tumors. Givastomig showed manageable side effects, dose-proportional drug exposure, and early signs of clinical benefit, especially in CLDN 18.2 positive gastric cancers. Based on these results, doses between 5 and 12 mg per kilogram were selected for further testing in combination with nivolumab and chemotherapy in frontline treatment. Results for the study were described under 8 main categories, namely, dose-limiting toxicities, maximum tolerated dose, common treatment-related adverse events, pharmacokinetics, biomarker, soluble 4-1BB, dose selected for expansion, objective response rate, and CLDN 18.2 expression in responders. This Phase 1 study enrolled 75 patients across 9 dose levels of Givastomig, ranging from 0.1 to 18 mg per kilogram, in the US and China. The median age was 63, with most patients being white, male, and having an Eastern Cooperative Oncology Group, ECOG, performance status of 1. Participants were heavily pretreated, with a median of 3 prior therapies, and over half had received PD-L1 inhibitors. Gastric and gastroesophageal junction, GEJ, cancers were the most common, and 75% of patients were CLDN 18.2 positive. Common metastatic sites included the liver and peritoneum. Dose-limiting toxicities are serious side effects that prevent further dose increases because they are considered too toxic or harmful. DLTs are used to identify safe dose ranges. In the current study, no DLTs were observed up to the highest tested dose, 18 mg per kilogram, indicating that Givastomig was well tolerated and had a favorable safety profile. Maximum tolerated dose is the highest dose of a drug that does not cause unacceptable side effects in most patients. Since the MTD was not reached, even at 18 mg per kilogram, it suggests the drug can be administered safely at high doses, which supports dose escalation or combination strategies. Common treatment-related adverse events are side effects that are likely caused by the drug and occur frequently in greater than or equal to 10% of patients. The most common side effects, nausea, anemia, fatigue, decreased white blood cell count, vomiting, and elevated liver enzyme ALT, were manageable and expected for cancer therapies, reinforcing the acceptable safety profile. Pharmacokinetics describes how the body absorbs, distributes, metabolizes, and eliminates a drug, here, measured as dose-proportional exposure. In the present study, Givastomig exposure increased in proportion to the dose, meaning its behavior in the body is predictable and linear, simplifying dose selection and monitoring. A biomarker is a blood-based immune marker used to assess immune system activation. Soluble 4-1BB levels plateaued above 5 mg per kilogram, suggesting that increasing the dose beyond this level might not result in stronger immune activation, helping define an optimal biological dose. The specific dose chosen for treating more patients to further assess safety and early efficacy. The 12 mg per kilogram dose was selected because it balanced safety, drug exposure, and immune activation, making it a promising dose for further study in target patients. Objective response rate refers to the percentage of patients whose tumors shrink or disappear after treatment, complete or partial response. An ORR of 16% in CLDN 18.2 positive GEC patients treated at doses above 5 mg per kilogram suggests early signs of anti-tumor activity, especially in a biologically selected population. CLDN 18.2 expression in responders is the proportion of tumor cells expressing the target protein CLDN 18.2 in patients who responded to treatment. Responders had a wide range of CLDN 18.2 expression, 11% to 100%, suggesting that the drug may work across various expression levels, but possibly better in those with higher expression. Study findings indicate that Givastomig was well tolerated up to 18 mg per kilogram, with no dose-limiting toxicities reported. Common side effects like nausea and fatigue were manageable. The drug showed dose-proportional exposure and signs of immune activation. Early anti-tumor activity was seen, with a 16% response rate in CLDN 18.2 positive gastric cancer patients treated above 5 mg per kilogram. Study title: Ipatasertib in patients with tumors with AKT mutations. Results from the NCI Match ECOG Akron trial, EAY 131, subprotocol Z1K. Published on July 17, 2025, this Phase 2 subprotocol of the NCI-MATCH trial evaluated Ipatasertib, a pan-AKT inhibitor, in patients with AKT1-E17K mutant metastatic solid tumors. Conducted as a single-arm, open-label study, it enrolled patients regardless of tumor type, provided they had the AKT1-E17K mutation. The study found that Ipatasertib demonstrated clinically meaningful anti-tumor activity, even in patients who were heavily pretreated, highlighting its potential as a targeted therapy in genomically selected cancers. Multiple tumors. Study 3. Title: Ipatasertib in patients with tumors with AKT mutations. Results from the NCI-MATCH ECOG ACRON trial, EAY131, subprotocol Z1K. This Phase 2 subprotocol of the NCI-MATCH trial evaluated Ipatasertib, a pan-AKT inhibitor, in patients with AKT1-E17K mutant metastatic solid tumors. The study enrolled patients regardless of tumor type, provided they had the AKT1-E17K mutation. It found that Ipatasertib demonstrated clinically meaningful anti-tumor activity, even in patients who were heavily pretreated, highlighting its potential as a targeted therapy in genomically selected cancers. The researchers described results in 5 categories, namely objective response rate, ORR, types of responses, median duration of response, common any-grade toxicities, and grade 3 or 4 toxicities. In the efficacy analysis of 29 patients, Ipatasertib achieved a 24.1% objective response rate, with all responses being partial. The median duration of response was 10.1 months. Common side effects included diarrhea, nausea, and hyperglycemia. 12 grade 3 events were possibly related to treatment, consistent with known toxicities of AKT inhibition. This study enrolled 35 patients with AKT1-E17K mutant metastatic tumors, out of which 29 were included in the primary efficacy analysis. The most common cancer types were breast, with 18 patients, and gynecologic cancers, with 7 patients. Notably, a majority, about 66%, had received more than 3 prior lines of therapy, indicating a heavily pretreated population. The objective response rate was 24.1%, meaning 7 out of 29 patients had measurable tumor shrinkage. With a 90% confidence interval ranging from 11.9% to 40.6%, an AP value less than 0.001 against a 5% null rate. This shows statistically significant evidence that Ipatasertib was effective. The 90% confidence interval, 11.9% to 40.6%, indicates that there's 90% confidence that the true OR lies between 11.9% and 40.6%. P less than 0.001 means the observed response rate is statistically significantly higher than the null hypothesis response rate of 5%, a rate that would be expected if the drug had little or no effect. The type of responses observed were all partial responses. This means that while no tumors completely disappeared, every responding patient experienced a significant reduction in tumor size. A partial response is defined as a significant reduction in tumor size, but not complete disappearance. No complete responses were observed, but the drug still showed objective anti-tumor activity. Among the 7 patients who responded, the median duration of tumor shrinkage was 10.1 months. This indicates that, among responders, tumor control was maintained for nearly a year on average, showing that Ipatasertib provided not just a response, but a durable one. The 90% confidence interval means that the true median duration likely falls between 3.7 and 10.8 months, indicating relatively durable responses for a heavily pretreated population. Common any-grade toxicities included diarrhea in 25 patients, nausea in 13, and hypoglycemia in 9. These side effects were mostly mild to moderate and are consistent with known effects of AKT inhibition. These are side effects of any severity level, with diarrhea being most common, 71%. These reflect the expected toxicity profile of AKT inhibitors, particularly gastrointestinal and metabolic disturbances. Grade 3/4 toxicities included 12 severe adverse events that were possibly related to treatment. These were consistent with the known safety profile of AKT inhibitors and considered manageable with clinical oversight. Grade 3 toxicities are severe, but not immediately life-threatening. Grade 4 would be life-threatening or disabling. The report of 12 Grade 3 events being possibly related to treatment highlights the need for close monitoring, but the toxicities were consistent with known class effects, not unexpected. The findings show that Ipatasertib provides a statistically significant and clinically meaningful response in a difficult-to-treat patient population, with an acceptable and predictable safety profile. The study met its main goal, showing a 24.1% response rate with Ipatasertib. Even in heavily pretreated patients, Ipatasertib showed meaningful activity across multiple tumor types with AKT1/E17K mutations. We've compiled all this information, with complete APA references of all studies, into a downloadable PDF. We've also given statistical interpretations of results. Get your copy today at https://payhip.com/b/QOYUZ. The link is also available in the video description section below and in the video title brackets. You can also request the PDF file by sending an email to statsage@gmail.com.